All right. So, we've had a lot of requests coming in about trench mouth.
Oh, interesting.
And it's not something I know a ton about.
Okay.
But as a medical, you being a medical microbiologist,
Yeah.
I thought maybe we could do a deep dive into acute necrotizing ulcerative gingivitis.
Oh, yeah. I'd love to.
Or ANG.
Absolutely.
And you sent over some really great resources, Microbeaky, the CDC, and Microbe Canvas.
Fantastic. Yeah, those are all great sources.
And honestly, I'm pretty intrigued.
Yeah.
Just the name, trench mouth.
Yeah, it's a pretty striking image, isn't it?
It is.
Yeah.
So, let's just start with the basics. What exactly is ANG? And, for a medical microbiologist, why should we even care about it today?
Well, ANG, it's a really kind of aggressive and painful gum infection, and it sort of comes on very suddenly. And people who have it, they have a lot of pain, their gums bleed very easily, and they get these ulcers kind of in between their teeth, almost like a punched out kind of look.
Oh, wow. So this isn't like, just regular gingivitis.
Right. No, it's much more severe than your typical gingivitis. Chronic periodontitis, which most people kind of know as gum disease, that tends to kind of come on gradually, and it's usually painless.
Yeah.
But ANG, this is really kind of this acute presentation.
Oh.
And it's part of what we call necrotizing ulcerative gingivitis, or NUG.
Okay.
And then if that NUG isn't treated, it can actually become chronic or recurrent.
So it's like a spectrum.
Exactly.
ANG being kind of the
acute form.
the acute form of it.
Yeah, exactly.
And then it can progress.
And then it can even, progress even further if it gets to the point where it's actually affecting, the bone supporting the teeth.
Yeah.
Then we call it necrotizing ulcerative periodontitis, or NUP.
Oh, okay.
Yeah. And that can actually lead to tooth loss, so that's a serious situation.
Wow. So, we have our medical microbiologist listening in. Let's talk about the bugs.
Yeah, okay.
What are the main players in this?
The two big ones are Fusobacterium nucleatum.
Okay.
It used to be called F. fusiform.
Right.
And then also the spirochete at Treponema vincentii.
Okay.
Which used to be Borrelia vincentii. So those names might be familiar.
Yeah, those ring a bell.
Yeah.
Can you talk a little bit about the characteristics of these?
Sure. So F. nucleatum, it's a gram-negative anaerobic rod-shaped bacteria. It's really good at sticking to and invading host cells, and it plays a key role in forming biofilms, which are, basically these communities of bacteria that can be pretty hard to treat.
So they're kind of hunkering down.
Exactly, yeah.
Make it hard to get to them.
Exactly, yeah. It's like a little fortress for them.
Yeah, that makes sense.
Yeah.
What about T. vincentii?
So T. vincentii is a motile spirochete. It's anaerobic as well. And it's got this spiral shape, so it can kind of move like a corkscrew and actually get pretty deep into tissues.
Oh, wow.
Yeah, so it makes it a pretty tough one to deal with.
So it's this kind of dynamic duo.
Yeah, exactly.
That's causing all these problems.
Yeah, you got it working together in that low oxygen environment.
Right, of the gums.
Uh-huh.
Are there any other sort of accomplices in this?
Yeah, so you also often see Privotella intermedia. That's another anaerobic bacteria that's often there.
Yeah.
And then there's a bunch of other spirochetes that can kind of get in on the action.
So it's a whole party.
Yeah, a real party in your mouth you don't want to have.
Not a good one.
Yeah.
So now let's talk about, who's at risk
for
this. What are some of the factors that make people more susceptible to it?
Well, I mean, the biggest one is probably poor oral hygiene.
Okay, that makes sense.
Yeah. I mean, if you're not brushing and flossing regularly, you're basically setting up a buffet for these bacteria.
Right, you're feeding them.
Exactly, yeah.
Yeah. So besides not taking care of our teeth, what else?
Smoking is a big risk factor.
Okay.
Because it damages the gum tissue and makes it easier for bacteria to get in.
Right.
And then malnutrition can be a factor too, because it weakens your whole immune system.
So your body's just less able to fight off anything at that point.
And this is where, I think back to the name trench mouth.
Right.
Those soldiers, they were under so much stress.
Yeah, absolutely.
Which we know suppresses your immune system. And so that makes a lot of sense in that context, right?
Absolutely.
So chronic stress, like those soldiers were under, it can make you much more vulnerable to infections like this.
Right. And then, anything that weakens your immune system.
Exactly.
Whether it's HIV or...
Yeah, HIV, AIDS, or even certain medications.
Right. So it really is like a perfect storm.
It really is, yeah.
Different factors.
It's like setting up the perfect environment for these bacteria.
Yeah. So let's say, for our medical microbiologists out there, if they're seeing patients, What are some of the signs and symptoms they should be looking for to maybe give them a clue that, oh, this might be ANU?
Well, there's 3 main signs that we look for. One is really intense pain in the gums.
Okay.
And then bleeding that happens really easily.
Even with like just touching it?
Yeah, even with the slightest touch.
Okay.
And then those ulcers that we talked about, those punched out looking ulcers between the teeth.
Yeah. So those are all pretty distinctive visual clues.
Yeah.
Anything else that might be a giveaway?
Yeah, one of the big ones is really bad breath.
Okay, makes sense.
And often with kind of a metallic taste as well.
Oh, interesting.
But you don't always get a fever or swollen lymph nodes.
Oh, so it's really just focused on the mouth.
Usually, yeah.
Okay.
Although children, sometimes they can have more of a systemic reaction. And in rare cases, especially in children with compromised immune systems, ANUG can progress to this really serious complication called cancrum oris.
Cancrumic oris, what is that?
Yeah, it's also known as noma.
Okay.
And it's basically where the infection spreads from the gums to the tissues around the face.
Oh, wow.
Yeah, and it can be really disfiguring and even life-threatening, so it's really important to catch ANUG early, especially in kids with weakened immune systems.
Wow, that sounds really scary.
Mm.
So how do we diagnose ANUG? What are the methods?
Well, mostly we diagnose it based on those signs and symptoms that we talked about.
Okay.
But we can also do a smear for the bacteria and some blood tests too, just to make sure it's not something else that looks similar.
So like what other things could it be confused with?
Sometimes it can be mistaken for acute leukemia.
Okay.
Or herpetic stomatitis.
Okay.
Which can also cause sores in the mouth.
Okay, so once you know you've got a case of ANUs on your hands, what do you do about it?
Okay, well, the first thing is to really clean the infected area. So that means irrigating it and doing what we call debridement.
What's that?
Basically, it means removing the dead tissue from the gums.
Oh, that doesn't sound very pleasant.
No, it's not fun, but it's really important to get rid of that infected tissue. And then after that, good oral hygiene is key.
Okay.
Brushing, flossing, all that good stuff.
Right. So kind of back to the basics of what we should all be doing anyway.
Exactly, yeah.
So are we talking like mouthwash, things like that?
Mouthwashes can help, yeah, and pain medication can also make people feel better. And in cases where the infection has spread beyond just that local area, we sometimes prescribe oral antibiotics like metronidazole.
So it's kind of a multi-pronged approach.
It is, yeah.
You're trying to kind of get rid of the infection and then also help the body fight it off itself.
Exactly, yeah, that's the goal. But you know what happens if you don't treat ANO?
What happens?
It can get really bad really fast. You can get rapid destruction of the periodontium, which is the tissue that supports your teeth. And the infection can spread too, leading to things like necrotizing stomatitis.
Oh, that doesn't sound good.
No, it's not good at all.
Yeah.
And like we talked about before, it can be especially dangerous for people with weakened immune systems.
Right.
And people who are malnourished are also at a higher risk of serious complications, including that cancrum oris, which can really disfigure the face. So it's really, really important to catch and treat ANU early.
Right. So it's not something to mess around with.
Definitely not.
Okay, so we've talked about what it is, the symptoms, the bacteria that cause it, how we diagnose it, and how we treat it. But there's this whole other fascinating part of this disease, which is the history, right?
Absolutely, yeah.
Where did this name trench mouth come from?
Yeah, it's a pretty interesting story.
Okay, so let's step back in time a little bit and see how AU earned its name.
Okay, sounds good.
Yeah.
It's amazing when you think about it.
Yeah.
How long we've actually known about this condition.
Right.
I mean, we're talking centuries.
No kidding. There are records of this going back that far.
Oh, yeah. Yeah. Wow.
Xenophon, he was a Greek historian and soldier.
Okay.
He actually documented cases of what sounds a lot like ANG.
Oh, wow.
In soldiers way back in the 4th century BC.
That's incredible.
Yeah, he described these soldiers having really sore mouths and like incredibly bad breath,
Yeah.
Sounds familiar.
Yeah, that's wild. So it's not like this is some new thing.
No, not at all.
That's just popped up. We've known about this for a long time.
Right.
So when did we start to figure out that this was like an actual medical condition?
Well, there's this Scottish surgeon, John Hunter.
Okay.
Really prominent guy.
Yeah.
And back in 1778, he wrote this really detailed clinical description of AG.
Oh, wow.
And what's really cool is that he was actually able to tell the difference between this and scurvy and also chronic periodontitis.
Oh, so he was able to separate it out.
Yeah, he was like, this is its own thing.
Just different.
Yeah.
Okay.
Which is pretty amazing for that time.
Yeah, that's a huge step Yeah, it really helped us to understand it better.
So we're starting to get a clearer picture of what this is.
Yeah, exactly.
But I'm still stuck on the name.
Yeah.
Trench mouth. I mean, how did that come about?
So the name actually comes from World War I.
Okay.
It was widespread among the soldiers fighting in the trenches.
That makes sense.
I mean, you can imagine.
Yeah, those conditions.
The conditions were just really bad for hygiene.
Right. I mean, just being in those trenches.
Yeah, I mean, cramped, dirty.
Yeah.
Not a lot of access to clean water. I mean.
And just the stress of being in that situation.
Oh, absolutely. The stress must have been unimaginable.
Yeah.
And we know that stress can really lower your immune system.
Right.
So it makes sense that they were more susceptible to ANUG.
Yeah. So trench mouth, it really kind of captures that whole historical context.
Yeah, it paints a picture.
It does. It does. So besides the conditions, was there anything else going on with the soldiers that might have made it worse?
Well, a lot of the soldiers smoked back then.
Oh.
And we know that smoking is terrible for your gums.
Yeah.
It damages the tissue, makes it easier for those bacteria to get in and cause problems.
So you've got the stress, you've got the poor hygiene.
Yeah.
You've got smoking. It's like the perfect recipe.
It really is, yeah.
Yeah, so you mentioned earlier there was a French physician.
Oh, Jean-Vincent.
Yeah, can you tell me a little bit more about his work and what he found out?
Oh, yeah. So Vincent was a physician at the Pasteur Institute in Paris.
Okay.
In the late 1800s and early 1900s.
Okay.
He did this really groundbreaking research on what we call fusospiritual infections.
Fuso what?
Fusospiritual. So those are infections that are caused by a combination of fusiform bacteria and spirochetes.
Okay, so we're talking Fusobacterium and Treponema, those two main culprits.
The two big players.
That we've been talking about.
Exactly. Yeah, so his research initially focused on these types of infections in the pharynx and the tonsils, and that led to what we now call Vincent's angina.
Okay.
But then later, in 1904, he found the same organisms in cases of what he called ulcerative necrotic gingivitis, which is what we now call ANU.
Ah, so he's the one who kind of put it all together.
Yeah, he was like, hey, these same bacteria are causing problems in both the throat and the gums.
That's amazing.
Yeah, it was a big breakthrough.
So Vincent's angina and ANG, they're both caused by those
pesky fusospiraceae.
Fusos. Whatchamacallit.
Exactly.
But they're different, right?
Yeah, they are different conditions.
Okay.
I mean, even though they share that same cause.
Okay.
Vincent's angina mainly affects the tonsils and the pharynx.
Okay.
While ANG targets the gums.
Gotcha.
So different locations, different symptoms.
Right, different problems.
Yeah, but that same microbial culprit.
That's so interesting. So we've gone from ancient Greece to the trenches of World War I to the lab in Paris.
It's quite a journey, isn't it?
It is. It is. So have there been any major developments more recently that, you know, as a medical microbiologist, I should be aware of?
Yeah, definitely. Right. In the late 80s and early 90s, you know, when the HIV/AIDS epidemic was really taking hold,
right,
doctors started seeing a really severe form of necrotizing periodontal disease in a lot of patients with, you know, really compromised immune systems.
Yeah, that makes sense. I mean, their immune systems are weak.
Exactly.
And they're going to be more vulnerable.
Yeah, so at first people thought maybe it was a totally separate condition linked specifically to HIV.
Okay.
Some even called it HIV-associated periodontitis.
Okay.
But over time, it became clear that this was basically the same ANUG we've been talking about.
Okay.
It was just presenting in a much more aggressive way.
Because of their compromised immunity.
Exactly.
Right.
So it wasn't a new disease. It was just an old disease behaving badly in people who were really vulnerable.
Right. So it's not that they were getting something different.
Right.
It's that they were getting the same thing, but much worse.
Exactly.
Yeah, and that really highlights how important a healthy immune system is.
Absolutely.
For oral health.
It's all connected.
Yeah, it really is.
And it really highlights, I think, how important it is for us to be aware of ANU.
Yeah.
Not just in the general population, but especially in people with underlying health conditions that affect their immune system.
It's like you have to be extra careful with them.
Absolutely. And this is where your expertise as a medical microbiologist is really important.
Okay, so it's about looking at the whole picture.
Yeah, exactly. The whole patient.
Yeah, not just the mouth in isolation.
Exactly.
We've got to think about the patient's overall health.
Right.
And it kind of brings us back to those soldiers in the trenches.
Yeah, it does.
They were under so much stress.
And that stress played a big role in their susceptibility to ANU.
Right. And we know that stress is a big problem for a lot of people today.
Absolutely. It's everywhere.
Yeah.
So it's important for us to understand how stress can impact oral health, especially for people with compromised immune systems.
So the lessons of the past.
They can really inform how we approach oral health today.
That's a really good point.
Yeah.
So we've covered a lot of ground here.
We have.
We've talked about what ANG is, the symptoms, the bacteria, the diagnosis, the treatment. Yeah. And now we've gone through this fascinating history.
A lot of history.
Yeah. I mean, from ancient battlefields to, modern day labs.
Yeah. It's a pretty amazing story.
It is. It is. But before we wrap things up, I want to bring it back to our listener, the medical microbiologist out there.
Yeah.
What are the key takeaways for them, in terms of their work?
For a medical microbiologist and year, it can be a pretty interesting challenge,
Oh, how so?
Well, at first glance, it seems pretty straightforward.
Okay.
Gum infection, you got your bacteria.
Right. We know the culprits.
Yeah, but like we've been talking about, it's way more complicated than that. There's this whole interplay between the microbes themselves, how susceptible the person is, and then all the stuff going on in their environment.
So it's not just about we found Fusobacterium and Treponema.
You got to look at the whole picture, the whole ecosystem.
So for someone in my field then, what does that mean?
Well, I think it means you have to really dig deep, understand that whole web of interactions. Yeah. That's how you're going to come up with better ways to diagnose and treat ANUG,
Makes sense.
And don't forget, even though it's in the mouth, it can affect the whole body.
Especially for those with
compromised immune systems.
Yeah, we keep coming back to that.
It's a big deal.
It really is. It's almost like a warning sign.
Yeah, like a canary in a coal mine.
Yeah, exactly.
If you see ANUG, you got to think, what else is going on?
Right. What else are we missing?
Exactly.
So it's really important for, all of us in healthcare to be talking to each other.
Absolutely. Yeah.
Dentists, medical microbiologists, everyone.
Got to work together, share information.
We're all in this together.
Exactly, because oral health, it's not separate from the rest of the body.
It's all connected.
Yeah, and for your listeners out there, I think the big takeaway is you got to see the whole person.
Okay.
Not just the bugs.
Right, not just the lab results.
Exactly. Think about what's going on in their lives.
Yeah.
Are they stressed? What are their habits? Do they have other health problems?
Access to health care?
Yeah, all that stuff matters.
It all plays a role.
Because all of that can make someone more likely to get AN.
So it's like we're detectives
kind of
trying to put all these pieces together to get the full picture.
And that's how you're going to really help people.
Oh, okay, so it's not just about the science.
It's about the whole person.
It's about understanding the person.
Exactly.
And how all these things fit together.
It's about seeing the human behind the microbes.
Yeah, that's a great way to put it. Well, this has been a fascinating deep dive.
Yeah.
I mean, we've learned so much about ANUG.
A lot more than just trench mouth, right?
Yeah, exactly. It's way more than just that name.
And it's really amazing how something that seems so simple can actually tell us so much about how our bodies work.
And how they interact with the world around us.
Absolutely.
Well, I hope this has given our listeners, especially our medical microbiologists, a new perspective on ANUG.
And maybe even some ideas for new research.
Yeah, keep those brains working.
Keep asking questions.
Keep collaborating.
Exactly. There's still so much to learn.
Absolutely. Well, thanks for joining me on this deep dive. It's been a pleasure.
It's been my pleasure, too. Thanks for having me.